Welcome to CCA's Medical Minute, sponsored by Kroger Health. This week is episode 37, and it's on collaborative care. And joining me is my co-host, Jill Hunt, who is our CCA Oncology nurse practitioner. Jill, it's always good to see you.
You as well.
Jill in the house. And also in the house, we have the CNO. That's the Chief Nursing Officer over at Kroger Health, Meggen Brown. Meggen, welcome to the show.
Thank you. So humbled to be here. Thank you so much.
We are so excited to talk to you, Meggen, because I said the episode today is about collaborative care. So we want to know first and foremost, what does it mean to be in collaborative care or with Kroger Health? What does that mean to the folks that come into your facilities each and every day?
Absolutely. So that is the pillar of everything that we do with Kroger Health. And it starts with, our team. We have 2,200 healthcare professionals across the country. And one of the things that I'm most proud of, it starts at the top. Our leaders are providers. Mm-hmm. So whether they're pharmacists, nurse practitioners, physicians, dietitians, we lead from the top. And it's not just, I was telling you earlier, it's not just a bunch of black suits sitting around a table making medical decisions. So with us, that's the reason I started with this company 13 years ago.
And that makes all the difference in the world.
Absolutely. So I knew coming out of school, I was working in emergency medicine as a nurse practitioner, and I had a pharmacist next to me, and I had a dietitian that I could call on. And then we also had a chief medical officer I could call on and a collaborating physicians. So it really is our holistic approach. That's what we stand for, and that's what is a differentiator for us. And then on top of that, we also, when we talk about collaborative care, it's not just what's in Kroger Health, because we can't do it by ourselves. So it's truly those partnerships that we build. Just here locally in Cincinnati, Mercy and Kettering Health Networks are huge for us. So I always say we had the bat phone to them, that if somebody needs something, or we need, whether it's an ultrasound or a CT scan, etc., our nurse practitioners and physician assistants are perfectly capable of ordering it. And then we work with those groups. So I really feel it's a differentiator when somebody comes on with us. They're like, oh my gosh, all these resources that I have for our patients. And, each patient's unique. So.
And Jill, you can understand that because you're an NP.
Well, absolutely. And that 100% for our oncology patients, because a big portion of our viewing audience are our patients or family members that have been impacted by cancer. They know they've got a list of different specialists, whether it's the medical oncologist, the surgical oncologist, the radiation oncologist. Most of the time they have a dietitian involved. Sometimes they have, just all different disciplines that are related to their care. So it definitely goes kind of hand in hand with what Kroger Health is doing compared to kind of the care that our cancer patients are getting as well.
Absolutely. We try so hard to make it simple. Healthcare is so complicated.
Yes.
Well, let's make it simple now. Okay, I'm a patient, or I'm coming into the little clinic, or trying to get some help through the Kroger system. What can the average person expect? What are some of the questions that you get, or how are they engaged?
So a lot of times people are fearful. They think, oh my gosh, I'm in a grocery store. Am I going to get quality care? You are going to get quality care.
Yes.
We are Joint Commission certified. We're very, very proud of that. So it's quality over quantity is what we have focused on. And, our own president is Colleen Lindholz, and she has made the brave statement of, we want to fill less prescriptions. So when a patient comes in let's say they come in for just a sinus infection, or they come in because they need blood pressure medicine, etc., we're doing a full head-to-toe assessment on that patient, because each patient's going to be unique, and it doesn't matter if I saw you 2 days ago. I'm going to do a head-to-toe assessment on you, and then I'm going to look over your well-being. I'm going to see, hey, are you up to date on your vaccines? How is your diet? How is your BMI? Have you had any checkups? Wow. And we really try to connect that individual with our technology. Allows us to electronically send all records to the primary care. We never want to take away from that medical home. But there are so many that don't have a medical home anymore.
Yeah, they don't know who's driving their bus.
Correct.
Well, and to kind of speak a little bit more into that, you're talking about like the problem solving, like a patient comes in with a problem, but Kroger Health is really involved in health and wellness as well. Can you speak a little bit to that?
Yeah, absolutely. So that's where where we want to spring off for sure. So with health and wellness, food's at the center. So we're Kroger. We are America's largest grocer. Yeah. So if we don't take what we have, that food at the center, and then branch out from it, we wouldn't succeed like we do. So now with that, we want to focus on the well-being of the patient, especially now that COVID has come through. It's, I mean, it's thrown us so many curveballs.
And now that you mentioned Kroger, and COVID, how did you all maneuver through that particular time when at its height, COVID was, shutting so many things down? And Jill, you can speak to the fact that here we've had to, pivot.
I just out in the community, I know, patients were utilizing the ability to get online and check what the wait times were in your clinics because they needed to be tested or various things. I can't imagine the impact that COVID had on your Kroger Health.
I remember the day that they sent us home for, not being in the offices. And then my boss, who's a pharmacist, he came over and he was like, all right, what are we going to do? And it literally, that March 13th, I'll never forget that day.
No one.
We said, hey, how are we going to pivot? So we, had to really change our strategy. It showed cracks in the healthcare system. And so with that, we said, how are we going to get to all of these patients that we know that Kroger can touch? So we had to come up with very unique. Within 2 weeks, we came up with our, COVID testing, the drive-through. We were the first in the nation to come up with that in partnership with HHS. So the big thing is we really went after our partnerships, and it's those relationships that we've had in our pocket, and then being able to pull those relationships out and say, I need your help. Yeah. CDC, I need your help. HHS, I need your help. And then going to our community partners as well. Some of them are our competition. We work together because it mattered for the patients, making sure we link through that. And so we took that model. We actually worked with Starbucks on that model.
Hey,
they can get people in and out.
Yes.
So, hey, Starbucks came to us and said, how can we help? We know we don't have any providers. How can we help? But we had those relationships through Kroger.
Right. And just the thought processes.
Yes. So they were able to help us speed things up. And
how many clinics?
So we have 226 locations in 9 different states. And the big thing is that it was our partnerships and our collaboration with our dietitians, nurse practitioners, and pharmacists, because we have over 2,200 pharmacies in 35 states. So whether it was us as nurse practitioners going out and training, I went to Chicago, I went to Colorado, I went to Texas, and we trained our pharmacists to get out there. That way we could go across the nation and deliver this model for collaboration with, COVID. So we're starting to, like I said before, it showed so many cracks in the healthcare system that I think that we have set ourselves up for success because we took our learnings very quickly and pivoted.
Yes.
So,
and that's crucial, especially when you're faced with something as huge as a pandemic.
Yes.
And we had we could control pretty much control the access of how many people were coming in and out of here, CCA, for our services. So we just wondered on such a larger scale, how did that work out? And you said you were able to manage that. What's it like today? Because we're still in pandemic in that mode, although we're kind of hopefully dialing back some.
Yeah. Right. It's so a lot of the things are still, like you said, on the tail end. We're still using a lot of the same things that we did during the peak of COVID, because number one is safety of our patients and safety of our employees. So if we don't keep our employees safe, that's where we start with. That's one of our pillars. You start with that safety, and then it trickles down. So, things that we didn't do before for pharmacy and for clinic is we didn't have waiting spots where you can call into, the pharmacy, or you can call into the clinic and say, hey, I'm here to be tested, or I'm here for my visit, because we want to limit the exposure. So a lot of people will walk into our clinics and our pharmacy now and they don't see anybody waiting. Well, we've got a queue and we're working through it, but we really want to keep people, as far out as we can, because that protects all our patients. The other thing is that we had to take, more extreme measures on like filtration and, to make sure we're protecting everybody that's still shopping. So that's the nice part, is like all of our filtration systems, all of our PPE equipment, everything that we had, we were able to use Kroger's distribution model to be able to help push this faster than most other places did, because we're so large.
Yep. Now, kind of switching gears a little bit, you guys are starting to get geared up for the big wellness festival. Can you kind of fill us in on what we can expect this year?
Oh, yes. I am so excited for our wellness festival. I'm going to be down the banks during a Reds game, too. So we like to collaborate with the Cincinnati Reds. So it'll be September 23rd and 24th. We did move it back a little bit compared to last year just because of the heat. But If you haven't been to the Wellness Festival, you need to have the experience. We've got cooking demonstrations where you can do it with our dietitians. We've got all of our partnerships coming in for biometric screenings. We also have where you can go in and do different relays with team relays, etc. So, it is a great experience. I encourage anybody to come.
Yeah, we're excited because we're going to be there as well this coming September, and we're excited about that. Meggen, we're out of time, but we want to thank you so much for coming in and sharing about collaborative care. Thank you as well, Jill. Of course, thanks all of you for being here. Next week, we're going to be talking to our friends from Melanoma Know More and talking about how their services are being disseminated out into the community. But thanks for joining us, and of course, share information, and we'll see you back here again next week.